Okay, it's time to talk about one of my favorite topics of the semester, health marketing. Health marketing is the application of marketing techniques applied to health behaviors, and it's aimed at helping consumers learn new behaviors and adopt new behaviors. So an example of this that we see everywhere is the simple hand washing campaign that still exists. If you go in a public restroom, you'll see hand washing signs. But this wasn't always the case. This had to start with a health marketing effort. Okay, so I use the terms health marketing and social marketing kind of interchangeably, and the reason is because the field of health marketing really began with the field of social marketing, and this was born as a discipline in the 1970s. Now we tend to call it health marketing when we're talking about health behaviors. Social marketing is expanded to things beyond just health behaviors, things like don't litter. It uses the principles of marketing and sales to sell ideas and behaviors instead of products. It's a really fun field that you can actually go into. If you like this topic, you might actually consider looking into furthering your education by getting a Master's of Public Health in marketing, or perhaps working for a nonprofit or a government agency that does these sort of things. Now, there isn't a standard name for the field. It can be called various things. And so health marketing, social marketing, it might be called a public health campaign, it might be called health promotion or a health promotion campaign, it might be called cause marketing. Cause marketing, I've got an example on the side here. This is a marketing attempt, a social marketing campaign to convince people to adopt dogs from shelters rather than from the doggy farms. And so this is a cause marketing because it's not health related, it's just trying to increase the number of dogs that are being adopted from shelters. It's important to realize what we're not talking about. So if you put in a Google search and you said social marketing, a lot of the top hits would actually think you're talking about social media marketing, but we're not. Social media marketing is simply using social media to do marketing activities. It's its whole other field, but that's not what we're talking about. The same is true with healthcare marketing. If you put in health marketing in Google, you might come up with hits that are talking about healthcare marketing, but this is not what we are talking about. Healthcare marketing is just simply that, the marketing of a healthcare facility or a healthcare plan. But we are talking about the marketing of health behaviors. So a health marketing or social marketing begins with this question of, okay, here's our topic, what needs to change? So for example, we know that smoking is a problem. If we were doing an anti-smoking campaign, well, what needs to change? Well, people need tools to quit successfully. They need motivation to quit successfully, or maybe we need to convince people to not start smoking, and that will help with the problem as well. Or maybe we need to provide tools and tips to the loved ones of people that smoke that allow them to become advocates for their loved one to stop smoking. And so that we have those big topics, but the health marketing campaign looks at what needs to change. It looks at that, what would be happening if we were accomplishing a better world? What kind of behaviors would be happening? Hopefully that sounds familiar to you because this is a concept from our textbook. Our textbook talks about when we're trying to promote change, one of the ways we can do that is to think about, okay, what would it look like if we were already achieving the change that we want? What would that look like? So a health marketing campaign then tries to move people in that direction with specific behaviors. The picture I have here is a social marketing campaign. It's an anti-bullying campaign, but the angle that they're taking here is promoting healthy behaviors of friends, helping friends see that they can stand up and how to stand up for a friend that's being bullied. We can try to achieve the same change by targeting different audiences. So for example, If you're trying to increase the number of women who are breastfeeding their babies, one of the most obvious messages that you would use would be directed to women who are having babies. And so you would try to convince them that they want to feed their baby by breastfeeding their baby. So your campaign might focus on that. But you might also achieve increasing breastfeeding rates by targeting different audiences. So on the left here is a campaign aimed at dads. One of the things that we know from research is that sometimes women don't breastfeed because they feel unsupported by the dad. And the dads want to be involved, and so they don't want to miss out on feeding the baby. So they don't really support the breastfeeding because they want to play a role in feeding the baby. So this campaign is aimed at dads, trying to help them see that they can be involved in many other ways. And they don't have to depend on just feeding the baby to be involved. There's a number of different ways to be involved, and they can support their baby being breastfed. On the right is a campaign aimed at people who are not breastfeeding, but are around women who are breastfeeding. And so it's encouraging people in the community to be supportive of women who need to breastfeed their baby and want to be in public. They want to participate in life. They don't want to be locked away in a closet or a bathroom. And so it's aimed at reducing the social pressure to be private with breastfeeding. It's not aimed at the mom, it's aimed at the community. So who does health marketing? Say you are interested in this and you kind of want to make a career in it. Where would you work? Well, places that do health marketing really fall into one of three categories mainly. Government organizations do quite a bit. So the Centers for Disease Control, the CDC, the FDA, they all have funding that allows them to do certain health marketing campaigns. And you can work for them, or you might work for the ad agencies that they contract with that develop the marketing materials. Nonprofit organizations exist that do health marketing. For-profit organizations, there are some that also do health marketing, especially the ones that contract with those agencies. The agencies will hire them to do the health marketing. This is a graphic from a program at George Washington University that has a public health in communication and marketing degree, if you are interested. The basics of health marketing is the same as regular old marketing. It all comes down to the 4 P's of marketing. This is what's called the marketing mix. And so there is a product, a place, a price, and a promotion, but these are a little bit different, especially things like price and product, than selling, say, a car. Instead, we're selling things like increased physical activity or increased hand washing during flu season, but we still apply the marketing mix when it comes to marketing. In some health campaigns, there might be a 5th P in place, and that 5th P might be a partnership that needs to be there. So for example, there was a campaign done by the Arizona Department of Health Services that was wanting to promote fruits and vegetables to young children, to school-age children, and they had money to do this throughout the state of Arizona. Well, the Navajo Nation does cover a large landmass in Arizona, but the Navajo Nation is a sovereign nation, and so the Arizona Department of Health couldn't just barge in and do a health campaign there. They had to establish a partnership with the Navajo Nation in order to be able to go in and provide the campaign to the kids living there. The 5th P might also be politics that is necessary. Another example at the Department of Health Services, the Arizona Department of Health Services, they had a campaign to promote breastfeeding among women, and obviously among women. And one of the things they found when they were trying to figure out why women were choosing not to breastfeed is because women did not feel comfortable going out in public. At the time, there was a law on the books in Arizona that made breastfeeding in public a crime, and you could get a ticket for indecent exposure. And so politics had to be part of this campaign to change that law on the books so that women were not afraid of breaking the law by feeding their baby in public.